Lyme disease is a growing issue in our state, and many would say it's hit epidemic proportions.
Very scary stuff. Tonight, John Krinjak introduces us to two families in our area who have been impacted by chronic Lyme disease and how they're coping with that disease. He joins us now with part one of the special series on Lyme in Maine. John.
Jim and Caitlin, you may remember back in January, we met Holly and Scott Lounder of Ellsworth. They were suffering from chronic Lyme disease, that is late-stage Lyme, that has gone untreated and causes often debilitating physical, cognitive, and neurological symptoms. When we first met the Lounders, wife Holly was suffering severe seizures due to chronic Lyme disease. But after several months of antibiotics, which have cost hundreds out of pocket,
I'm walking more normally and I have better control of my arms and muscle movement, and I haven't had a seizure in months.
Same with husband Scott.
When you first saw me, I was doing the whole shaking bit and all that, and that has since then subsided.
But as this Ellsworth couple begins to win their fight with Lyme, the battle has begun on a new front. Their daughter Chelsea tested positive.
Right now I'm doing track, which is kind of hard because like the workouts we have to do, I almost never can complete them.
Chelsea's symptoms are more physical, while her sister Jenna is showing cognitive signs of Lyme, which has affected her education.
Yeah, college put on hold till next year.
What was that like to have to make that decision?
It was really sad, but I kind of came to the realization that I'm not going to be able to make it through stressful college if I can't sit in the classroom for more than a couple hours.
Turns out it's not uncommon for Lyme to show up multiple times within a family. Teresa Burialt of Stetson and her daughter Danielle recently learned they both have it.
She had symptoms off and on that for years, unfortunately, that we just thought were growing pains.
After an initial negative test here in Maine, a more comprehensive test done in California revealed a positive result in Danielle.
I was online all the time, researching and studying and trying to find out as much as I could about it. And the symptoms that I have are also symptoms of Lyme, which I had no idea, because they're completely different than what she had.
Teresa had Lyme as well. Antibiotics have worked well for her, while Danielle is slowly improving.
I haven't had to be in bed day after day, but the pain levels, they go down and they come back, and the fatigue some days is better than others.
Danielle says having Lyme has prevented her from doing a lot of the activities she loves, like horseback riding. But now that she's on treatment, she's hoping to spend a lot more time with Jake here very soon. In the meantime, a special diet is helping with inflammation.
She's had so many allergies because of this, so gluten-free, dairy-free, soy-free, we're eating healthy.
And these two families are hardly alone.
I think Lyme disease has been increasing in the state of Maine, and I think almost always its spread precedes our recognition of its spread.
Dr. Szantyr has spent the past 2 decades investigating Lyme and says its symptoms can be elusive.
I try to get them to think in terms of multi-system, multi-symptom illnesses that have not been explained. And most of the time that, they include fever or neurologic or neurocognitive changes, including aches and pains. So recurring flu. You don't get the flu once a month. That's not okay.
Problems also crop up with diagnosis.
The sensitivity of a test is its ability to pick up a positive case. That test method, when you look across studies in the literature, the best it does sensitivity-wise is about 66% sensitivity.
Now, as to whether Lyme can in fact be passed from parent to child, Dr. Szantyr says research in that area is insufficient, though many with Lyme strongly believe it can be. It's important to note as well that both the Lounders and the Burialts have had to go out of state to get their treatment. And in fact, many chronic Lyme sufferers have had difficulty finding treatment here in Maine. So tomorrow night at 5, we'll look at why this is, why long-term treatment is so controversial, and why many in the Lyme community are hoping to change and how this disease is approached. We'll be right back.
Last night on TV5 News at 5, we had the story of two families affected by chronic Lyme disease.
Tonight we look into the growing controversy over how Lyme is diagnosed and treated and what you can do to protect yourself. John Krinjak has the story. John?
Jim and Caitlin, the families we profiled last night see their journeys as cautionary tales. After all, Lyme can happen to anyone who sets foot outdoors in our state. And so we talked to Dr. Szantyr about ways you can minimize your risk of getting infected in the first place.
Someone who's been long-term sick, truthfully, I haven't seen people recover without antibiotics.
Dr. B. Szantyr travels around the state educating people about Lyme disease.
My message, prevention is the best action.
She says protecting yourself begins with what you wear outside.
If you tuck your shirt into your pants into your socks, take on that ever so slightly nerdy appearance, you create a barrier from the ground to your wrist.
And for exposed skin, repellents are helpful.
DEET is still the mainstay, it's the gold standard.
And a full-body naked tick check when you return.
Proper, timely removal can save you a world of hurt.
But for those already infected, especially those who went undiagnosed for years like the Permethrin-treated, finding proper treatment can be tricky.
And you can't find a lot of doctors on the web, on the internet, as far as Lyme literate. They just, at least not in this state, they don't advertise.
Why do you think that is?
I think they're afraid of having their licenses taken away.
So why is Lyme so controversial?
The controversy comes from whether or not persisting symptoms equals persisting infection. Some physicians are concerned that they will become targeted, isn't the right word, maybe it is, but they may be looked at and investigated if they treat with longer courses of antibiotics.
And for those who do get longer treatment, it's usually out of state and out of pocket.
I think a surprising number of insurers seem to have adopted the Infectious Diseases Society of America's clinical guidelines, lock, stock, and barrel. Which is pretty much not more than 30 days.
Lyme disease should be listed as a notifiable infection.
Those clinical guidelines are precisely what many in the self-proclaimed Lyme community are hoping to change.
We're fighting to have the testing changed and the diagnosis changed and the treatment changed.
Holly Launder coordinated a protest in Augusta this past Friday. That's where we met Aaron Gilbert, whose wife and 2 sons have Lyme.
The children, we had to actually move to Connecticut to get treatment because we couldn't get them treatment here in Maine.
Here outside the State House, members of the Lyme community are raising their voices, hoping to raise awareness and just maybe get some laws changed inside these walls.
We need laws to protect our Maine doctors here so that they won't be afraid to treat chronic Lyme patients.
Is that something that you hope the lawmakers at the Hill take notice about?
Absolutely. I hope they'll hear us loud and clear today.
Back in Ellsworth, the Lounders struggle to keep their martial arts business afloat. Holly remains on the sidelines due to her lingering symptoms.
Just not being able to do what I want. I know what I want them to do, and I can't explain it, and I can't physically do it.
So I jump up and okay.
But Scott is well enough to teach classes again, marking a hopeful moment in what's been a long, arduous journey with an elusive and controversial disease.
Okay.
Now, it's important to stress that having a primary care doctor you trust and can work with is perhaps the most important thing when battling a disease like Lyme. For a complete list of tips on preventing Lyme disease, visit our website, wabi.tv, where you'll also find a link to a Lyme support group in our area and to the worldwide Lyme protest movement. Jim and Caitlin, the good news, there is hope and people do get better, though as you saw, that process can be both emotionally and financially draining. Back to you guys.
Very interesting, very enlightening, very scary.
Yeah, it's nice they told their stories, and it's good to see them getting better, but it's scary.